Health is a big issue for us out here. It's just that, that passion for health is really important for our community. A lot of the communities don't talk about health, but I can talk about it all day. But it's just this community here, we had a lot of stuff going on here. We care about our health, we care about our people, our kids now. It's coming up, who are growing up to be men and women, They're going to be our future, you know what I mean? Because I'm not going to be around a long time, other time, but we still live off our bush tucker, our porcupine, our kangaroo, our Jubullum, our switchity grub, okay? We still live here today off it. But we need that bit of support. Support has come a long way, but we're trying to help each other because we're very believe in our culture. We still speak our language here, we're all one mob. We support each other, but we need support from outsiders, really to break that little bit of it, in our mind, because it's really hard, I tell you.
So the purpose of running education sessions like this is to provide information to general practice in regards to Aboriginal health, what their problems are with inside a community, why people won't identify, and just giving them some solutions to barriers to help them provide better services to Aboriginal patients with inside of their practice. And that's basically what we're doing here today, just sharing cultural information and bringing awareness, I suppose, to issues that aren't readily out there for people to develop that awareness about what's going on in Aboriginal communities.
I guess I was always aware of Aboriginal culture. I've grown up with Aboriginal people and in-laws and family, not Aboriginal myself, but I still learn a lot here today that I didn't know. I thought I did.
So when I started here, I realized that there are a lot of Aboriginal patients, but I didn't receive much information or education regarding the pathways and everything. So today's session was really good, and got to know about the 715 and then the resources available and the pathways, how to access. Yeah, it's good.
Very good to have a variety of Aboriginal people who are in the game that I haven't met before, and a wide variety of opinions, and learn a lot about programs that I wasn't aware of.
Coming here was great. First of all, you brought it to us, which means we didn't have to travel, and we can still, even if we travel to Armidale, we get home an hour and a half later, and it's a late night, which reflects in the practice the next day. And it was great to put faces to all the people and find out what the PHN actually does.
I think our practice is very open and friendly to everyone and every culture, but it doesn't hurt to learn little bits all the time, and if we can make contact with people that can help us out with knowing more, that's great.
The engagement that we had from the guys here tonight was really good, and what that means to me is that we had general practitioners, nurses, and reception staff that really want to make a difference. They want to close the gap.
I just find it's very important that people identify, and we ask people to identify, and in being in a medical practice, I know everyone has different medical issues, and depending on their culture and where they're from and their background, whether it's the colour of their skin, their living arrangements, their history, I got a lot out of it tonight. I really enjoyed it.
We got a decent conversation going, so really engaging,
I would certainly recommend other GPs come across to the nights that you run in other country towns.
We have a lot to close that gap, we really do, and I think this is all going to help.